once again, let me welcome everyone to our webinar on bringing human services technology into the 21st century, the role of change management in facilitating innovation. Today's event is convened by the American Public Human Services Association, the Annie E. Casey Foundation, Case Commons, and Harvard Kennedy School's Ash Center for Democratic Governance and Innovation. Our moderator is Stephen Goldsmith, the Daniel Paul Professor of the Practice of Government and the Director of the Innovations in American Government program at the Harvard Kennedy School. Steve will be starting us off today. Steve?
Thanks everybody for joining us for this important conversation. As you know, this is a particularly challenging time for child welfare and across the country continue to great challenges both for families and children and also for administrators trying to do their best and workers against different odds to make things work for our country and our communities. To have some of the most experts in the country involved in this discussion, and a pretty interesting discussion because I think it looks at these issues from the perspective of the caseworker. How can we support the caseworker better? How can we help him or her job better and result improvements in for children? And with that, I'd like to start by introducing Patrick McCarthy, the President and CEO of Annie Casey Foundation. As everyone on the phone knows, not only is Patrick esteemed leader, but Annie Casey has long been the foundation most involved in these issues nationally, and will start us off. Patrick.
Thanks, Steve, and hello, everyone. Happy to be here today. Talk a bit about the role of decision-making in services. Because from my point of view, human services systems are in the decision-making business. Everything from frontline workers to line supervisors to commissioners, they're all called upon to make very, very tough decisions, and sometimes they're life or death decisions, certainly altering decisions. They're always consequential decisions every single day. A member of my own family were involved in one of these systems. I want to make sure that these are the best decisions that could possibly be made, because they're decisions that will make the difference as to if someone in my family would get what they need or not. I think we should hold the exact same expectation for every single family that comes into contact with human services. I'm really very optimistic about the potential for smart technology to help fulfill this notion that every family ought to get the absolute best decision every day. I think smart technology can have a tremendous impact on our ability to achieve better outcomes. There, we need to ensure that every single worker is well supported in the decisions they make. We need to ensure that every single system is organized and managed to enable those workers to make good decisions. And we need to ensure that we have the right policies in place, policies that address the accurately understood challenges that we face, well-informed solutions. The challenge here is that, frankly, we're human. And based on what we know from the field of decision science, on the one hand, we know humans are actually quite remarkable decision-making machines, and on the other hand, we're quite imperfect in our decision-making. One of the powerful things we do is to create a narrative. We make up a story, and then filter facts to fit into that story. That's how we manage the immense amount of data that wash over us every day, and that's how we negotiate the world. Now, this is a strength, but in the work we're talking about today, it's also a huge risk. When you put together a narrative, when you construct a story, not only begin to edit out what doesn't fit that story, the science actually teaches us that you don't even perceive things that don't fit in that story. When we have one of these terrible child welfare tragedies, one of the most common things that people say is, my goodness, how could they have possibly left that child in that home or left that child in that foster home? How could they have not seen the red flags? It was so obvious. Well, the reason folks don't see those red flags is because they don't fit the narrative. They don't fit the story that all make up to make sense of the world. So if there's an individual making a decision, then sometimes situations will arise in which the story that individual makes won't fit facts, and a terrible decision resulting in terrible consequences. We can only know what we know. We can't what our more experienced colleagues or our wiser colleagues or what our entire department or our entire system may know. In fact, some of our greenest workers, some of our most inexperienced workers, have to do some of the toughest calls long before they've accumulated the experience and judgment we'd want them to have if they were dealing with their own family. And in fact, even experienced workers confront situations they never encountered before. So what do people do in this situation when they haven't seen a situation before? Well, they rely on what they know. They rely on their intuition. And that's right, and sometimes with painful consequences, their intuition doesn't know enough or it's just plain wrong. Each just has one set of experiences, one perspective, one lens that we can apply to a situation, but these are incredibly complex, and each one has unique characteristics and circumstances. Even if we've encountered what we think is the same situation in the past, each of us easily miss out, we throw out important information. Now, if we made the wrong call the last time we saw a similar situation, applying that experience or intuition to this new situation and then making the same call won't be helpful. Finally, not great at spotting trends in oceans of data. While we might be very good at constructing a story or putting together a narrative, we're not very good at recognizing patterns and trends in large amounts of data. When all we have to go on is our individual experience, it's hard to extrapolate from that to trends and patterns. In fact, when we do have the data, when it usually comes to us in the form of reams and reams and reams of printouts without sophisticated analytic tools, which are not built to spot the patterns and trends that we need to. Fortunately, we believe that technology can help to overcome these challenges. Things technology can do is to help workers do better by, number one, help them develop more efficient workload management. Now, with frontline workers take these kinds of jobs because they want to help families and they hope to engage in good practice. But they discover they may end up spending 30% of their time or 40% of their time or even 50% of their time doing paperwork and trying to wrestle with the information system. So technology can streamline data entry and information management, and that would simply give frontline workers more time to spend in frontline practice. In addition to that, we know that workers spend a whole lot of their time trying to coordinate among a lot of providers and other members of a family support system. We know that this usually ends up in a whole lot of phone tag with the worker as the hub among a lot of spokes connected to the family. Too often it's left to chance whether the right people are getting or giving the right information. Again, technology can make a difference. Technology can make it much easier to communicate with and among the folks necessary for good practice and rapid response. Follow-up on referrals that we make to providers can also make a huge difference in whether families get the right kinds of assistance, but also can be very cumbersome and time-consuming. And sometimes the best thing that workers can do is just simply give the family a business card and tell them to call the substance abuse agency and let them know how it went. Again, technology can help. Technology can streamline and improve this process and make all the information easily accessible and facilitate the process of getting approvals, thereby making the connection with providers simpler and tracking what happens. We know workers are multitaskers, but again, as humans, most of us manage workload when things pile up with a last in, first out kind of system. Whatever's the last thing that went on the pile, that's the next thing that we deal with, and as a result, something that may be high priority or more important to a family ends up getting buried in the paperwork. Again, technology can help by helping these critical situations to be kept in view of the workers and helping the workers concentrate on the activities with the highest payoff or the most critical situation. Technology can also help support effective practice itself. Again, in any organization, we count on the experience and wisdom that the more experienced staff have accumulated. We hope that experience gets transferred to new staff. Sometimes that just doesn't work. A new worker may find herself in a home at 2 o'clock in the morning, and they've got to decide what to do. They can't wait until they can check with their more experienced colleague the next morning. Technology can help facilitate real-time connections that can make a real difference. Again, it's not just new workers who need access to good information. Everyone's practice gets better when we have access to the best of what we all know. It can help by linking workers to information, linking workers to tools, linking workers to guidance on best practices. For example, you may be seeing your first chronically neglectful family, but as a system, we've seen thousands. So we're able to use technology to give the worker hints on here's the 5 things you ought to be checking out, or here's the 10 questions you ought to be asking. And if you see this particular kind of pattern, get a hold of your supervisor right away to have a conversation, because that pattern means something about the safety or well-being of that child. So that the best decisions are made collectively by all those connected to a child, by not only the social workers but also extended family members, private providers, physicians, teachers, those who know the child and family. Again, technology can help. Technology can ensure that everybody has the most current information and facilitate collective working together. You don't just have one person with one narrative. You have folks in the conversation who are challenging that narrative and offering different perspectives and different facts. Also can use technology to get better feedback loops and, very importantly, more informed supervision. Human services supervisors are absolutely critical to link from the administrative policy to what really happens at the front door and in the living rooms of families. So giving these supervisors with the right tools to monitor performance in real time can make a real difference in whether they are able to support and strengthen the frontline workforce. So, for example, we know that a very small percentage of workers actually account for a very large percentage of bad outcomes. We've been reviewing performance on various evidence-based practices. And we look at this carefully, we recognize that a supervisor who's able to quickly identify workers who are having trouble can target training to those workers, and what a difference that can make for families with whom those workers interact. Supervisors and managers are able to access regular, accurate, and relevant information on the metrics for their units. They use that kind of feedback to make the kinds of small adjustments in real time, making the kind of tweaks that regularly mean that practice can, those kind of tweaks regularly means that practice can improve continuously, and that's better for everyone. One of the ways that technology can improve system performance, that very few system leaders actually have information at their fingertips that they can take any kind of action on. They all have information that's timely, but also information that is supported by the kinds of visuals and other analytics that help them quickly see the big picture and the spot patterns and the spot trends. Very few of us can really take in reams and reams of information and ferret out the most critical information. So being able to see the big picture in this way, we've got to be able to help supervisors and system managers dig down into the details that are needed to accurately diagnose a problem. The Casey Foundation has consulting teams that go out and work with states all the time. One of the things we found is that they often don't have even basic data on things like what are the age groups in their system, what kind of problems show up the most, what's the occurrence rate for abuse or neglect, what's the path that children and families actually take from intake on, what are the rates at which young people are aging out without a permanent family, or what are the patterns and uses of residential care or hospital care. So it's a question of how you can take effective action as a system manager. We really don't even know what the problem is. We all experience this. Sometimes we have a very strong idea of what a problem is, but once we see the data, we understand the problem we thought we had isn't the problem we actually have. Once we understand that, we can begin to solve the problem we actually have. Technology can help track and present this kind of critical information. It can track performance in real time. It can even notify a system manager with alerts when performance measures go off target. Imagine you had a system that starts to blink at you just like a pilot has, that tells you to pull up, pull up, pull up, because you're headed in a really bad direction. But to the policy front, it's not just system leaders who end up with having to make decisions without good information. In fact, policymakers can easily end up in the same boat. They get overly influenced by a couple of anecdotes or a good, compelling story. That comes along and they listen to that, and now all of a sudden you've got legislation or regulation that may be well intended, but it's just informed anecdote, good story, and it ends up being really unhelpful. Make your system harder to manage, more difficult to navigate, tougher families to get the help that they need. On the other hand, if instead you're able to, number one, offer real-time analysis, number two, display trends in the performance metrics, number three, identify connections between data points, you can start to have a conversation about where the problem really is, if there is one, or make a persuasive case for a necessary change. And you can set up reasonable benchmarks for tracking whether the change is actually having the intended effects. So substituting data-driven decision-making for reliance on so-called common sense or common knowledge is a place technology can really help improve outcomes. In addition to these kinds of technological changes, and I think we have made a lot of progress, we'll hear from Judge Payne a bit later about the difference it can make in a state to have really good information technology. But in addition to all of that, we've got ways to go before we can see the full benefits from technology. There are a number of things we can all work on together, we can all advocate for, we can all continue to chip away at. Just a few of them. Number one, we could build common consensus on a core set of information and decision points that we ought to be paying attention to. Right, whenever one of these new information systems or decision support systems is built, it's got to be customized around a specific jurisdiction. The fact is, every jurisdiction uses just slightly to sometimes significantly different data definitions. Different core processes like intake or eligibility are handled in different ways. So instead of having modules that you can implement in system after system, you have to hand build each one. Not only is that inefficient, it makes it really hard to compare across systems and see if I might have solved the problem that I'm having or see what performance standards might be reasonable when we're starting up a new program. A tough issue we've got to deal with collectively is managing confidentiality. Now, there are very legitimate concerns about all this information we're collecting and sharing through technology is going to end up. I sure wouldn't want confidential information about my family bounced around the internet. But at the same time, we can't let that concern totally immobilize us. We find ways to manage informed decisions and informed consent and to keep the proper and appropriate respect of privacy intact. We have to invent some new standards and develop some new confidentiality protocols for this age. We should go ahead and work on that and not simply to continue to wring our hands about it. Third, to increase our focus on families. One of the most important things technology can help us do, if it's built correctly and managed in the right way, is to focus on families. Now, it would be cleaner and simpler and easier to just focus on one child at a time, but that's going to be a long way from the reality that children live in. In fact, children live in families, and families are dynamic systems with multiple relationships. That means lens has to be focused on the entire household and sometimes the extended family as well, and on working for change over time with that household rather than dividing that household up to individual children. So these are some of the tough challenges we face. I've got to say I'm very optimistic that working together we can solve them. The result, the capacity of technology to support better decisions at scale across all of our human services systems is well worth the effort. Thank you very much.
Yes. Should I go? Okay. So this is Kathleen Keeley. I am following Patrick, and I have worked at the Casey Foundation for 4 years or so. I'm the President for Innovation, and today I'm really speaking also in my capacity as CEO of an organization called Case Commons, which was spun out from the Annie Casey Foundation about 2.5 years ago. And I think Patrick gave this a great opening on technology and what it can do, and I think the easiest way to understand what Case Commons is about is that we are trying to build that technology to do many of the things that he talked about, and we want to do it in a very different way than technology has been built in the past. So, as I said, Case Commons is a private not-for-profit, and we have very different goals than many of the technology companies that are building software for the public sector human services. So our goals are to improve life outcomes for children and families, particularly for our country's most vulnerable children and families, those who use the human services systems in our country, and particularly the child welfare system. We want to focus on and support best practice. So we want to support those frontline workers who have to knock on people's doors. We want to make sure that they have the most up-to-date information right before they go into the house. They have access to supervision and their team members, and they have tools that are built into the application that could help them think of those, I think Patrick said, the 9 things that you might want to do if you are coming up to see a chronically neglectful family. We want to get data into decision-making at 2 levels, at the frontline level, so that we make the best decisions for families at the time that we have to make them with the most up-to-date information, and at policy level. We aim to give policymakers up-to-date decision, what's happening right now, not 2 years ago or a year ago when the data can be analyzed. We can build historical data sets up to the present, and so that the director can know what's going on, the supervisor can know what's going on in her caseload. The performance of programs, services programs can be judged, and resource allocation can be decided appropriately based on those outcomes. We want to also address the younger emerging workforce. We are really attempting to build Casebook in such a way that it's faster, it works better, it's more intuitive and mobile, and has the flexibility to change over time as practice merges, as we know it will. So we're not trying to freeze in time the practice that's built today, but we'll be able to change it because we are building it in flexible modules. Commons was incredibly lucky. Foundation was actually very lucky to have worked with the state of Indiana through the consulting group that Patrick mentioned for about 3 or 4 years, and they decided that they were going to rebuild their ICWA system, which was their formerly SACWA system, and themselves. And so we went out there early on after Case Commons had built our beta, which was for Casey Family Services, and we knew that the technology worked and so forth. And we were really fortunate to be able to enter into a partnership with our terrific colleagues in Indiana to configure the application that we built for them and into MAGIK, which is what it's called today in Indiana, and to together to help bring this technology to the rest of the country, human services, particularly, as I said, child welfare. So Jim's going to talk about what's going on, or what happened with MAGIK, and I'm going to talk to you about the ideas behind Casebook a little bit more. Casebook is built on a social networking platform. So much of what we do in child welfare is help fragile families get connected to social structures so that they can get the support that they need. Their neighborhood institutions, YW, YMCAs, churches, schools, etc. And so we were struck by the social networking platform and began at the Casey Foundation and began to really investigate what this would take. And that was the genesis of Casebook. So we also do everything very differently than many people build legacy software. Legacy software uses something called a waterfall process, where you probably have all heard of this. You put together requirements, you choose a vendor, the vendor designs what the system's going to look like, they get it engineered, then they test it, and then it's launched. And often, by the time it's launched, it doesn't quite meet the needs of the agency because it's always changing. So Case Commons in the early on made a decision to use something called agile methodology. This is a methodology that's used in technology, high tech, and all the sort of technologies that we're all getting familiar with from the internet that we want to make available to our child welfare workers. What this means is that if you look at the pink ball, we really work in the beginning to try to understand the reality of what's going on in the field at every level. At the frontline level, supervisors, managers in the field, managers in the central office, eligibility, licensing, and so forth. Everybody who has a part in making this system work. We try to understand what their system works with, what are the barriers that they're facing, what are the frustrations, and we try as best as we can and with the budget that we have to overcome those barriers. And we develop prototypes, usually paper prototypes, but sometimes click-through demos, click-through prototypes that we can test with workers and get their feedback, and then we put it into code. And when we get a feature set, we go back to the people that we've been talking to and with other workers in the system and test it. So the testing process is not done at the end, and it's not just quality assurance, although we have that also. It is the testing to make sure that what we've built meets their needs to the best of our ability. So we have continuous testing, and as we go on and we go to new feature development, we can ensure that we iterate constantly on what we've learned from the past, so that it's not like totally different sections, but we build on what we know, and the people that are working with us in the field can do the same. I want to show you a little bit of what we've developed. We aren't going to do obviously a demo here, but the next slide shows you a person page. As Patrick said, we believe that systems should be more than case-based. This Casebook is not case-based. It's person, group, and relationship-based. So we can wrap a case around a group of people or around a person. We wrap a household around a group of people or around a person. But it's not the only way that we think of people. We think of people in groups and in relationship to one another. And so on this page, you'll see that as you can scroll down, you get the educational history, you get all the houses where a child has lived over their entire time that they've been involved with the state. You can get their medical history, their mental health history, so that we can do a longitudinal analysis pretty easily with Casebook. And that's something that I know that we at the Casey Foundation in the Strategic Consulting Group had to 3 steps to get to a longitudinal analysis to work with, or to help states understand the dynamics of what was going on in their system. So we also have developed this network page that you can see now. We found that workers really like the graphic interfaces that we're able to build into the application. They're very familiar with them from the internet. And we also found that workers were collecting information about families and extended families, the family network, but they weren't putting it into the system. It had to be, it wasn't necessarily required, and it's very time-consuming, as you know. And they didn't really go back to their legacy systems to get information out. They used their notebooks, so there was no real need for it to get into the legacy system. We're hoping to change that with Casebook and to have the workers use the information that's in the application. That will help with making sure that the data has veracity and is very reliable. If workers are going to use the information, find the family's address or phone number, they'll make sure that it's in there correctly. We also found that the notebooks were walking out the door with with the workers when they moved on or left, and the next worker that came had to rebuild all that information about the extended family, the teachers, the counselors, etc. As said earlier, we are very interested in getting data that's of interest to both the field and in policy. This slide shows you a case listing of a caseworker, and you can see it in the Eisenhower family. The children, Ariel and Daniel, have not been seen for 58 days. Now, I want to emphasize this is not Indiana data. This is training. This is demonstration data. So, but this really helps workers keep track of a very important safety metric, and it can be rolled up by supervisor, and it can be rolled up to the management level so that we can develop graphs very easily that show the trends in terms of visitation, and we want to do that with other metrics that will be built into the application in the future. Where this can go is that we want to do as we get more confident in the data and people trust the data and believe that the data is correct, we want to move to more predictive analytics. So it's something akin to a prognosis in medicine. That if you look on this slide, what we show is that the first two children listed on this under the graphic representation shows that these children are not likely to be functioning at grade level when they exit foster care. So that we put a lot of data into this behind this graphic to show that if something doesn't change, these two children are not likely to be functioning at grade level. So it's like an early warning system for the workers and for the school that we've got to do something to help these kids get up to grade level so that they don't end more disadvantaged by being in our system than they were when they came in. And so we are, again, I want to echo Patrick's enthusiasm. I think that we're very optimistic about the future of human services and how it can be benefited by what we're doing in technology. And we want to join with people around the country to actually do that, show that, and we begin to make some headway in improving life outcomes for kids and families. So now I'm really pleased to introduce Jim Payne. Jim is a colleague and a friend and a great leader. He had the foresight and was willing to take a risk to bet on this new technology in Indiana, and is now, I think, as interested as we are in getting it around the country so that other people can have a look at it. And this is just the first of its kind. We hope it's not the only one out there. We hope that other people begin to use this kind of technology. But Jim is really a leader and a risk taker, and so I'm very honored to introduce him as our partner.
Thank you, Kathleen, and thank you, Patrick, for this lead-in and now this opportunity to present. I note in the chat list there is a request for contact information, and I don't know how else that may be, so I will give you my contact information. I am now associated with the Bronner Group out of Chicago, and my contact there is jpayne@bronnergroup.com. If you're interested later on in learning more about the Indiana system, the MAGIK system, and that stands for Management Gateway for Indiana's Kids. New director, Judge Bonaventura, and Robert Bobby Johnson would be pleased, I'm sure, to follow through with any requests or questions you may have. I would suggest your contact should be robert.johnson@dcs.in.gov. And so with that as an introduction, and I don't see my slides up yet, so I hope they come up soon. But I want to describe just briefly our circumstances in 2005 when a new governor came in and had a situation where there was really what I would call chaos in the system. We needed to address and look at a number of things. First of all, we were terribly understaffed. We had poor performance. In fact, 3 of our case managers had been indicted criminally in 2003. There was really no practice model. But one of the most important things, what we had was a system, a computer system, that was truly antiquated by technology terms, but it was built back in the 1980s when SEC first came out. Not only was it not portable, that is, usable in the field, it was not user-friendly. For instance, over the years, they had built in 800 screens, and one can use or even know 800 screens, so it wasn't used much by the field. In our research and looking at some of the things that case managers did as we were looking at doing the workforce and building a practice model and looking at data, we found that caseworkers were spending about 40% of their time on the computer, inputting and accessing information. Just one example, they had to go into separate screens to put a name in. That was the antiquated technology. And we found that it was very expensive to maintain. And therefore, it was cost prohibitive to either modify or fix. And in large part, that was because of the old technology, which in 1980 was very good, and it was probably state-of-the-art in the 1980s, maybe even into the 1990s. But as things developed and as things improved, the intent was to add on to it rather than to fix or modify it. As we came in 2005, the goal was to modify fewer screens, more credibility in the input and data by increasing the opportunities for ease of use. We knew that we needed data reports. There was little we could do, and I'll just give you one example. And we were hiring over a 3-year period of time 800 new case managers, 150 new supervisors. We need to find out where they should be assigned and where the greatest need was. We could not even tell literally what the caseloads were. We knew the number of we had. We knew the number of case managers we had. But we did not know where those cases were or what the caseloads were. So literally, twice a week, when we started, we were asking the case managers to count those cases and call that in so we could keep track of that. It was something as simple as knowing what we had and where we had it. We want, in terms of the data, to have more tables and categories so we could find out and analyze and then make management decisions on what to do. And that we wanted to work with our provider, that is the contractor that we had running our computer system. So we looked at the design, we looked at the codes, and tried to figure out over a couple of years how we could fix this. And the meetings and the changes we had were incredible. We finally decided that we weren't going to be able to fix it with the contractor we had. Said we will try to fix it on our own. We hired people. We tried to bring in some programmers and others to do that. And then we decided that we couldn't fix it. And I won't go through that, but we decided to build it on our own. And to do that, we wanted to know what we needed and wanted what we built to fit our needs. We didn't want our needs to fit what was built. In other words, we built our practice model as we hired case managers, as we created programs and talked about data. We wanted the computer to fit our needs and have our needs fit what was designed by the computer. So on this next slide, we decided what we wanted. First of all, we wanted to make sure that we had the use of current and opportunity for adaptability to future technology. As many know, technology changes quickly, and we wanted to be able to have our new case management system adaptable to that technology. We wanted to be able to used in the field, not in the office, although usable in the office, but it had to be usable in the field, both by inputting data and getting information out of that. And we wanted to be adaptable to the changing technology, where it was a notebook or a tablet or portable like a handheld or even a smartphone, that we wanted our new system to be adaptable to that portability. And we want, as Kathleen mentioned, I think, this program to be something that the next generation of caseworkers would understand and appreciate. That it design things, they tend to stay, particularly in government, for a long time, and that means adaptable to the new generation of caseworkers, particularly since we were doubling our workforce. We want lots of reports. We want and data, because we in Indiana pride ourselves on moving to data, not only at the administrative level, but also at the caseworker level and supervisor level. We wanted it to be somewhat supported in-house. It was important to us because we in Indiana in 2004 relied almost entirely on our contractor to provide what we had, rather than having some influence, impact, and opportunities. And for that, we wanted to make sure that we were capable of answering and giving data that SACWIS wanted, but didn't necessarily want to be tied to it. We make sure that this was built for Indiana and for our case managers. And for it, we wanted to do what I heard Kathleen call one time social reengineering, and it's talking about what kind of input and access others outside of our child welfare agency could have, where it was a counselor, a therapist, a teacher, a medical professional, foster child parent, that they actually look at this information. And finally, our goal was to make sure we cut in half the time that managers spent on the computer, from 40% to approximately 20%. So all of that requires to have a partner, a good partner. And our first partner, frankly, for me, was the team that we built inside the agency. Starting off with Bobby Johnson, with Glenn Frederick, with Allison Cheney, and so many others on our team that we built a vision for what we wanted. And then we wanted to partner with someone who shared that same vision, look at what currently is, and find out what is best, not only for now, but in the future. For us personally, that meant changing the paradigm, that this system would be based on the agency's needs. Those are important. And as administrators of state, we knew we needed to have our agency needs fit, but the primary goal was to fit the caseworkers' needs, that they were at the hub of this wheel of information, and all the information and came back into there. And we want to re-engineer the concept of access and input for those case managers, using things not just like typing on the keyboard, but activated dictation, handwriting recognition, and using other technologies that will come along. And that we built that regardless of what is our currently outdated technical system. And finally, we needed these three things listed. First of all, we need to do this quickly. This is not a 3 to 5 year project. As many of you know, an agency head typically won't be there a long time. Secondly, most administrations are limited by time. So we had to make sure we built this quickly, that was in the part of the mainstream of the work of the case manager by the time our administration was over. We wanted to be able to modify it with a lot of difficulty as changes came in the requesting of reporting or other information. And finally, the third thing, we did not want to be tied to scope, and that became critical based upon our experience with our prior contractor. We wanted concepts and designs of what we wanted and not be tied to scope, which often would create not only additional expense, but extensive modifications an extension of the contract to build. And they wanted this thing to be built quickly, and they wanted to add, refine, and perfect it over the next months and maybe a year or so. So the current status now is that we built this system called MAGIK with Casebook in approximately 18 months. We were virtually on time and on budget. We were training as we were building. We did that through what Bobby Johnson and others put together, a very extreme use of power users or super users who were not only testing the system as we were building it, they were being trained to use it well, and then they were going to be those who would train the field when we rolled it out in July of 2012. We wanted to make sure that the field had the tools to actually use this in the field, and we think we did that through getting first tablets and notebooks so that they're available, and then making that available in other ways in the portability. Again, Caseworker is at the hub, and let me just give you one example. When I visited one of the offices as we were rolling this out, I stopped by a case manager who was working on a computer, and she said it used to take her 3 hours to input one family, and that with this new system, from 3 hours to put in one family, it was taking her 1 hour to put in 2 families. So the efficiency was clear, which meant access to that information and data that comes from that information is more usable and more up to date, frankly, more accurate. We, for the most part, built everything inside, but with some outside modules that we continue to perfect and modify as we move forward. My experience is that the case managers are actually taking their laptops, their tools into the field and using them. They're finding great use and opportunity and effectiveness in doing that. So you have real-time data. This whole thing is built for speed and for the future. The increasing technologies that we have, this system will be more adaptable and portable, more accurate and more usable. It will solve the problem that we all have from time to time, and that is making sure that our case managers are the most efficient they can be. Is not changing the practice model in many respects from the management of a case to actually asking our case managers to understand trauma-informed care and evidence-based practice. And there are even more critical things right now that are coming out into the practice, and personally I'm working on that is predictive analytics. As we're looking at those models and put into a system, having a good information management system that case managers time to work with the families, with the children, as we heard Patrick talk about, together as we heard Kathleen talk about, we are at that point where progress is really made in Indiana. So with that, let me introduce my friend and partner in many things, Tracy Waring, who is the Executive Director of APHSA, a former leader in our industry in Arizona. When she's with the child protection system there, gone to the federal government, with the Homeland Security, now doing a terrific job as the executive director of APHSA, NAPQA, and other organizations that are so strongly supportive of the work in the field in the states. Tracy?
Thanks, Sam, and hello, everyone, and good morning or good afternoon, wherever you may be. Again, this is Tracy Waring with the American Public Human Services Association, and I think you've just heard some very compelling reasons for investing in technology and innovation in our field. And what I'd like to do as the final panelist here is to take a few minutes to broaden the picture a bit and discuss how the investments that we just talked about fit into the bigger transformation conversation that's occurring in our field and what we all really have to pay attention to in our respective entities to help guide that change. So I hope my brief remarks today will prompt your own thinking about your own role and influence in a collective transformation effort and direct you to some tools that may help you guide individual efforts in your states and localities. So my comments this morning or this afternoon are rooted in our members' vision for the next generation of health and human services, an initiative that we call Pathways, and you see it on the screen here. The intent today is not to go into the details of this effort, but to share some key aspects of the work, helping embed modern approaches to our work, spark new innovations, and support the spread of existing innovations like Casebook. And so at its heart, Pathway is focused on achieving greater impact at less cost, and ultimately about achieving better, sustainable results for our communities and the children and families that live in them. It is a transformation effort that's centered on the 4 outcomes that impact areas that you see on the screen here: gainful employment and independence, stronger families, adults, and communities, healthier families, adults, and communities, and the sustained well-being of our children and youth. Is that desired future state that we're all looking towards? We certainly are seeking a system that is person and family-centered, that's integrated and interoperable, modern, cost-effective, that really is operating with the current thinking of the best business models, and you've just heard some examples of what that can look like from an infrastructure and technology perspective. A system that's accountable for meaningful results, that use data effectively and analytics, and you just heard some ideas that may be coming as next generations of the thoughts around Casebook, around the use of predictive analytics, and certainly a system that's focused on ultimately making sure that we're getting those positive outcomes for the families that serve, and not just caught up in outputs or other types of compliance that don't really get to that end game, and certainly a system that's funded in ways that support these goals. And I think if you look at that list here that's on screen there, you'll know how technology can play a supportive role in every aspect of that work. The laser focus really on that desired future state and the meaningful key outcomes, it's so central to the transformation effort. And so part of our work at the American Public Human Services Association has been to work with other partners around thinking through what does that end game look like. And so on the screen here is a framework that was developed by Harvard's Leadership for a Networked World. It's referred to as the Human Services Value Curve. It's a high-level roadmap for thinking about transforming an organization's business model to one that focuses on generating healthy communities by co-creating solutions. There are 4 stages, as you see on the screen there, and I am going to tell you up front, not going to do justice to this view curve at the moment. We could spend a lot of time talking about each component of the model, but I put it on the screen to give you context about how we've been thinking through and supporting agencies and thinking through what stage they're at. And so you'll see in orange a regulative business model. That's really where agencies are serving constituents who are eligible for particular services, and they're complying with categorical policy and program regulations, so they're meeting the law. And then you move up the curve to a more collaborative business model where you're supporting constituents in achieving all the services for which they're eligible because you're working across agency and programmatic boundaries. And then a little further up the curve you get to integrative, where you're really addressing the root causes of client needs, coordinating and integrating services at a more optimal level. Then to the final stage, which is really a more generative human services system that's focused on generating healthy communities by, again, co-creating solutions for multidimensional family and socioeconomic challenges that are before them. So this model is a useful frame for understanding where agencies are on their transformation journey, and it's been embedded into guidance that we've recently developed here at APHSA to support human agencies' efforts at greater interoperability and integration, and I'm going to cover a little bit more of that in a moment. How do we move up that value curve then to the generative state? There's some key strategies listed here that talk about how we need to move beyond our traditional governance lines and really think about a shared agenda across the public-private sector, how we meet our customers where they are with modern marketplace tools, of which you just saw one certainly highlighted, that we allow for more thoughtful but more importantly, more aggressive adoption of innovations. We tend to know that there's some key innovations out there, but it takes us a long time to spread them. And building on the many known successes that are already out there, again, getting to adoption of innovations more quickly and being able to get out of the outmoded policies and business practices that have often, I think, trapped us instead of getting us where we need to go. So I think it's worth noting that technology and modern business engineering are supporting mechanisms to each of the strategies on the screen here. So what I do in the next few minutes is speak briefly to some of our association's experiences with change management in supporting state and local agencies' transformation efforts. And while we could easily devote a lot of time on any particular topic area, I'm going to focus on 3 recommendations. The need to focus on continuous improvement and organizational effectiveness, the need to operate with a 21st century business model, and the need to develop and draw on adaptive leaders at all levels of an organization. So now on the screen you should see a circular model there, which we refer to as our DAPIM, D-A-P-I-M, model flywheel. And so we have an organizational effectiveness team at APHSA that has developed an organizational improvement model focused on how to help agencies think through a continuous improvement approach to their work. I'm not going to go into great detail on the model itself, but I do want to highlight the D, define, and the monitor, the M, for just a second, because they're 2 key components to the work. In our experience, having an operationally defined D is one of the key elements that can make a continuous improvement effort succeed or fail if you don't have it. So oftentimes what we see, agencies will start with the A, the assess, and seek to assess themselves not against a realistic desired future state, hence the conversation we just had and the importance of really thinking about where is the end game, where do you want to be. This is why I think so many initiatives sometimes seem disconnected or unrelated because they haven't necessarily, it's a bunch of initiatives within one organization instead of being focused on a direct line of sight to that desired future state. So just an important piece to keep in mind. Another piece is we often see that folks will skip the monitoring component. That's the part that really continues to hold us accountable to our progress, maintains our line of sight to our desired future state, and provide the opportunity to adjust midstream. And I think you heard even in Judge Payne's comments a few minutes ago about how important that was in the effort around Casebook. And so 2 key components to this to think through a change effort. So our organizational effectiveness team and our work is really designed to empower teams within leadership at public sector agencies to help them think through this. And so we had over 70 projects in more than 30 states and localities, and we're actually undergoing a formal external evaluation that now has some promising initial findings that we will be sharing more publicly soon. So I hope that folks will have an opportunity to reach out to us if you'd like more information about what we can support with in change efforts around our organizational effectiveness work. Then see on screen a 21st century business model. Again, my purpose here is not to go through this guidance specifically, but to just share with you that we have combined the thoughts around what are some key characteristics of a modern business model for integrating horizontal integration of health and human services to best meet the community needs of the folks that we're serving. And we've combined the features of this model with the 4 stages of that human service value curve that I showed you earlier, and to create a matrix that we've named as the HHS Integration Maturity Model. The maturity model is an increasingly common tool, as many of you may know, used by organizations to assess where they are along an evolutionary path toward increasingly high levels of systems efficiency and effectiveness. So we have a set of guidance around what are the 10 characteristics of a 21st century business model, and then a matrix that local and state agencies can use to figure out where they are on that value curve. We actually just recently sent out a survey to many of our members to assess themselves around that value curve, and we'll sharing additional tools and insights on our website and other venues throughout 2013, so look for that. And then finally, I just want to touch briefly on the notions of adaptive leadership. Our efforts and our work with our members is probably not surprising to anyone that leadership is the key to successful transformation efforts, and really leadership at all levels. And you saw and you heard Kat's comments about how important Judge Payne's leadership was in their launch in Indiana. And there is this notion out there that we've really borrowed from the work of Professor Ron Heifetz at Harvard around adaptive leadership and what that can mean to the human services field. And we've spent some time thinking about how that concept applies to our field. So adaptive leaders, you see some bullets on the screen here, and I'm not going to go in great detail, but just to share with you the notion that leadership, when you think about it from an adaptive perspective, is really requires actual leaders in all levels of the organization to understand that the organization isn't one monolithic entity. It has varying ecosystems that are bound together by that common purpose, and it's that common purpose and desired future state is the piece that brings folks together. Adaptive leaders are able to look ahead and adapt strategies and tactics for their unfolding reality before them. They not to be turf-oriented, and they focus placing the organization in the larger enterprise. To adjust mid-course, they're able to focus on flattening the organization instead of creating more hierarchy. And they're aware of their own biases and shortcomings that may impede their work. So not all adaptive leaders are built alike, and we've spent some time with some partners really thinking through some of the key adaptive leadership types, and you'll find on our website some articles that we've written around thinking through that particular notion of what we've seen as really effective adaptive leaders. And we are about, probably within the next 10 days, to release a toolkit that will help agencies think through how adaptive leadership can help them advance any sort of transformation or innovation efforts within their public agencies. So look for that. So with that, I have my contact information on the screen. Certainly, if any piece of these that I touched on you'd like to know more about, you can both find information on our website, or you can contact me directly, and I'm happy to support folks in any way that we can. And I think it is my responsibility then to turn it over to Stephen Goldsmith, who is going to help us through Q&A.
Thank you, Steve. This is Cara Sullivan from the ASH Center. We might have lost Steve momentarily, so on behalf of Professor Goldsmith, I'd like to thank all our panelists and just let our participants know that we have about 20 minutes for Q&A, so if you do have a question, please submit a question via the Q&A tool. We have a number already, so let's just dive right into it. Our first question, build your own when an off-the-shelf solution is available. I don't know, perhaps Judge Payne, would you like to take that one?
I'd like to start off, but I'd like to throw it to Kathleen.
Okay.
Kathleen has much more experience on a national level with others, working with other states. Mine is more parochial, having worked in Indiana.
Okay.
My experience in looking at systems, which we did, when we decided to build, since we could not modify our old system, we looked at a number of systems and found them to be built more for an individual state and circumstances that did not fit our model. and most of the time, and Kathleen can get into this a little bit more, were built with the technology and the information capacity that existed at the time, and we found were not modern enough, not prepared to use the current technology that was available. So, Kathleen, would you like to expand on that, please?
Sure. Thank you for that question. We worked in Indiana, and I think we said this, or the judge said this before, that we had this idea from the very beginning that we were actually building a platform that could have those elements that are core to all child welfare systems would be on a platform, and that we would be able to then configure pieces of that application for each state, making it much simpler, so that if HHS decides to change the APHCSA data elements, we would not have to each state spend whatever it would have to spend to change not just the data element, but all the downstream places where that element shows up. If we had an application, we could do it in one place, and the downstream, it would be way less costly for everybody, and it would get us to a place that I think Patrick outlined, where we're getting more and more common across the states. So it's a relatively new technology in terms of the last 10 years. It's also, our system is a software as a service system, which means that we take care of it, and we free up the states from that responsibility, which you heard the judge say was expensive. And so I think that the very
I just want to try to interrupt here, since we have 10 questions and 4 speakers and 14 minutes. So
okay, sorry.
Okay, because it's helpful, but let's think about this the following way, because I got a lot of questions about the technology. A minute on case management tools generically as contrasted to SACList, right? Tools that support the caseworker as contrasted to tools that support the oversight supervisor, right? Federal, state, and I don't know if it's from any of the 4 of you. Why not COTS tools? Why not commercially off the shelf? Why not other vendors? I don't want the conversation to be on a particular solution, but why a solution that's aimed towards case management's good, and then just recognize that there are lots of questions from folks about kind of software tools and kind of how you thought about these things when you built Casebook.
Okay. So the reason they built Casebook is that it's the first one that is built on the internet. It's not housed in someone's servers. It can be. It could be like deployed onto a private cloud in a particular state if they wanted to, if they had the technology to keep up. But that's really, there were none. You load them onto a server, and we don't do that. We deploy it from a single place to the state, and it doesn't require really, and we take care of it. We have people who take care of the code and so forth, and will be a platform, so it could serve multiple states. Those are the differences.
Yeah, so this is Patrick. Let me just add real quick on the case management question. One, if the case manager is not incentivized to put in good data, then the management data is going to be worthless. So you need to build a system that supports the case manager, because then they're going to be invested in getting the data right. Number 2, it's a simple matter of looking at the amount of time the case managers spend put information into the system. You capture that time that can be put into for families rather than sitting in front of a desk. And number 3, the critical decisions that case managers make are made in real time, and so they need a much more flexible kind of system that supports the work that they actually do. the system-level decisions that get made are not they're out of, obviously, from aggregate data and trends. So all those reasons, I think that's why Kathleen and her team the attention to building a system that supported the case manager.
You know, we see in this area and others across the country, as Kathleen mentioned, that as a service does allow the adoption at much expense than those big legacy systems in a highly kind of adaptable way as well. Hey, Judge, another set of questions here about, you know, folks in an agency who've been inundated by paper. We may pretend we're all, you know, technically savvy, but not everybody is. So there's a lot of questions about adoption, about caseworkers. And I remember from both you and Kathleen, they went live in Indiana. Obviously, it wasn't there, but I heard you both talking about it. And you were on the phones and received like not a single complaint from a caseworker during the transition. So you want to spend a minute on how you built this with the caseworkers in your agency and what was their resistance level and how did you overcome it?
Let me start, and Kathleen, you fill in from your end. I think it takes a number of things. First of all, in order to be adaptable to new technology, leadership has to be an integral part of that, visible and fully supporting the concept of new technology. Secondly, to have champions, to have leaders, whether it's at the county level, at the office level, at the regional level, who are the champions. And third, it is finding those people who can be at the real local base level impulse of we have, in a number of ways, as I mentioned earlier, start off with our super users who were trained as they were going along, who could see this and then talk at the local level about what was happening. It wasn't it was thrown on everybody at the last minute. As it was being developed in the agile model that they were using, they were taking that back and working with it at the local level. We manned the phones, as you suggested, and I felt leadership needed to be there. I was at the phone line when we went live answering phones. I wanted to be, and I challenge everyone in our state, that first 4 months I would be better at MAGIK than they would. It was actually 1 month that it lasted. But I wanted to be a part of this, and I told them, and I did part of the demonstration. So leadership is a critical part of that. But even with all of that and all that Kathleen will now tell you, there will be people who will not adjust and will not adapt, and accommodations have to be made for that in one way or another. Really with our new workforce, they're coming in not only adaptable to this, but asking for it and frustrated about the old ways. Kathleen.
Thanks, Jim. I just want to add one thing because I think that Jim touched on most of the things. What we found is that people who were new to the agency, who didn't have the experience with the SACWA system that they memorized, the ICWA system, that they had memorized, that though the new people who were coming into the agency and being trained for the first time on MAGIK had a very high rate of they liked it. And then the group that had to switch over from one system to the other had some, you could see the varying degrees. And we didn't do it by age, of course, but I have a feeling that people who are, my age and didn't grow up with computers had a tougher time than people who were, had grown up sort of loading software and being really quick. I mean, that's what I would guess, but I think that it's, I think we have to get better at this and understanding it and how do we help people get to technology. I do think people who have adapted now, I think that there's probably still some people who would rather have the old technology. And it's a very tough problem and it involves that change management strategies that Jim talked about, and it absolutely involves the leadership being involved in it and really helping people make that transition, feel like it's important to make that transition.
I know there's a few questions in here about private confidentiality, and without having the conversation get drowned by the lawyers. A couple questions. These legal issues are folklore and some are real. I've got two questions. One generally, how in the Indiana deployment, how many data was integrated, how many data sets were pulled in, just generally what were confronted. And then secondly, I know that there have been some improvements here in the FERPA interpretations as it relates to student information. We have a couple questions on our chat side about how school information was incorporated. So I don't know whether it's Tracy, Jim, whoever feels like they can kind of handle the data issue and privacy questions.
Jim, you probably have to speak more specifically what you've done. I could talk more generally.
Why not generally, and I'll talk specific, okay?
Yeah, I think you've said it, but in terms of probably the most important part of the considerations around the privacy piece is that we spend a lot of time dealing with myth as opposed to what actually can be done. And so without getting into a lot of details, I think if folks are confronting concerns around privacy, sharing of information, and how to protect it, there are ways to do it. We have the technology to do it, and there are a lot fewer barriers than I think are perceived to be out there. I do know that work afoot in the federal administration at HHS within ACS, the Administration of Children and Families, to provide some additional guidance in the very near term around confidentiality issues and privacy and how to think through how they fit together, and so folks should look for that. But anyone who's I think experiencing difficulty in this should look. First of all, feel free to contact us, and we can pair you up with other states that have worked through issues, and not let that be the barrier that I think it has been for far too long. When actually there is a great deal of ability within the law. Jim?
I knew you'd answer it correctly. It's hard to. But to build on that, you did describe that there is much more myth, for instance, on FERPA than there is reality. And one of the recent issues that I know has come up nationally, the issue of CAPTA and issues of fatality, and there are ways to do that, and there are myths about what can happen. In terms of technology, though, and Kathleen can address this more perhaps, that there are ways in technology to limit access to specific data and information contained in information management system. That might have been the case, but I think, again, many things were designed around the myth rather than the fact, and I think there's more of a recognition, and I think we'll see that more and more based upon the several tragic incidents we've had over the last few months, that the inability to share information among professionals who are dealing with the same individual, the same family, with even the same kind of problems like mental health, the ability to share that data and to receive that information and use that information is perhaps at this point being a very detriment to the service that we hope to provide. Kathleen?
I think that you guys covered most of it. I do think that it's really important to understand that the technology is not the problem here. The technology is available that can make pieces of information not available, it can do whatever we need it to do, it can do. It's really that if people tell you that's not possible with technology, that's at least with our technology. And so I think that we need to figure out what it is that we want to do and then build the technology to do it, not the other way around. So I think that's what I want to say. I agree with both Tracy and Jim on the other stuff that they said. I think that it's also possible to do integrated services. I do think it's possible to do integrated services with a different kind of technology like Casebook that's built on a person, relationship, and group. So I think it's possible to integrate services, keeping mom's information, shielding that from her health information for example, shielding that from the school counselor who may not have a right to see it. So I really want to emphasize, I think that new technology makes a lot of things possible that are actually faster and more efficient and even less costly it's out of the paradigm of thinking in terms of how do we change legacy systems, and we just sort of begin to move with, over time to a new kind of technology.
We got, let me just see if I can sneak two more questions in here. One is, how both graphics and the, the dynamic vitality of your maybe what you might call your report generator, but there's a couple questions in here about how you can disaggregate the data in Casebook around race, income, certain types of outcomes. Are there any restrictions on how you can do that in Casebook, or can you pretty much do whatever you want?
Casebook, everything can be disaggregated because we keep the data by person. Everything can be disaggregated. So if you get a data set or a trend, and you want to see which children contributed to that trend, and you can absolutely by gender, race, age, etc., geography, but you also can drill down to see which children. So if you want to understand a length of stay issue or something like that, you can look at particular cases that we actually include in the analysis of that. So it can do both. It's very flexible. It uses this method called small multiples that was developed at Stanford University, and it actually turns out to be a great tool for analytics. So, we're just beginning to we're not just beginning, we've been working on it, and we're just beginning to see all the terrific things that are possible with it.
Lastly, this is close to hopeless in a 2-minute conversation, but there's lots of federal funding issue now. There's funding. One of the questioners notes that would have been applicable if child welfare would have been brought into it. There's restrictions on qualified funding for innovations such as this. I know it's a work in progress, and HHS is thinking about these issues, but any one of you want to make a comment about prospects for funding?
This is Tracy. I'll try to do this very briefly. I know we're wrapping up, but I would just say, to the extent that there are opportunities like the 90/10 funding that is on the health side, that there's an exception right now that allows you to use to the extent that you're building new systems on the side and connect it to the human services without having to do the normal cost allocation piece. There are opportunities out there. Folks should be looking for them. There are other pieces of policy changes that will be required by our federal participants to make this happen. And so I think the more that the federal agencies get the sense that folks are really wanting to make sure that their staff and the folks that they serve have the modern experience, the more they hear that from state and local agencies that are carrying out the work, the more we're going to have the impact and be able to drive these innovations in a more effective way. So part of this conversation is also creating that network and voice about this is what we should expect for our staff and for our for the workers and for the folks that we serve, and we need to, I think, collectively make sure that we're advancing that message.
And this is, just quickly, Steve, this is Jim Payne from Indiana. We are unique in that in order to do what we have done in the kind of way we've done it, in the partnership way we've done it, we're unable to access any of the 4E funds to help fund the construction of this MAGIK system. As we did that, we looked at the 90-10, and there were limitations even on that in building a child welfare system. And that's what the feds, I hope, will look at. How can they help states build systems in a more flexible and adaptable manner? Thank you.
Well, let me thank our presenters and maybe summarize by saying I think that the goal here is to look at a few factors, right? One is that APHSA is not alone in an example. I can say this without word fear of contradiction, but of big systems designed primarily for oversight purposes, not designed for purposes of seeing how we can do work more efficiently, designed for purposes of making sure people don't make mistakes, to kind of control the expenditure of funds and exercise discretion. And over the last several years, right, we've seen a confluence of fact, right, we have handheld devices that are available virtually everywhere. We have cloud-based technologies that can break through the earlier barriers of high cost to integrate legacy systems. We have data mining techniques that allow us to take information from highly discrete data sources, structured and unstructured, and look for patterns that they create. We have sophisticated algorithms that can be written against that mined data that provide decision support tools to folks in the field. We have the ability to identify outliers that can help supervisors look at caseworkers who need help, need training, or have questions, as was suggested before. And we can put those together now in a way that provides an opportunity to support decision-making in a field that's often under attack because it's easy to second-guess. And I hope all of our listeners, we have an extraordinary number of people who registered for this call, will thank, obviously, Annie Casey Foundation for its decades-long initiative in the area, Kathleen for her and innovative thinking with respect to Casebook, Payne, one of the pioneers of child welfare leadership around the country, and particularly with respect to case management tools and tablets for his caseworkers, and Tracy for her national and state leadership in these areas.